My name is Magali de Castro. I'm the Clinical Director at HotDoc, and I would like to welcome you to this webinar, Running Flu Clinics, Current Vaccine Features, Top Resources, and Practice Setup. We will be looking at the 2016 flu season and what the flu vaccination season has in stock for us this year. Now, this webinar is brought to you by HotDoc. HotDoc takes a great pride in providing clinics with the latest resources, including relevant and up-to-date evidence-based training, including just like this webinar. And we have also a lot of CPD modules that are in our blog, and this webinar is actually being recorded, and we will be translating it or making it into a CPD module that will live in our blog. So if you're not able to attend the entirety of the webinar today, or if you've got colleagues that you think would benefit from watching this presentation, then feel free to refer them on. This webinar will be ready on the website next week. Usually takes us a couple of days to get it up and running. So if you have any questions, feel free to write them in the questions tab to the right of your control panel, and we'll try to address them towards the end of the presentation if we have time. If we don't get a chance to address all of the questions, no problem. We will be able to email all those responses back, but we'll also include all the answers as part of a Q&A section within the CPD module once we publish it next week. All right, so we might get started. All right, so what we'll be looking at today, in this session, we're going to be covering the key flu vaccine considerations for this 2016 season. We'll look at how to set up the practice for effective and safe patient flow. We'll look at effective patient recruitment strategies. We'll also cover Medicare versus private billing, which is an area that I get a lot of questions around, and what are the MBS or Medicare items that we can and cannot claim. And we'll also have a look at what are some of the best resources to support flu vaccination efforts in your practice. All right, so for the 2016 influenza vaccine, what's new? So we know that it's going to be the government-funded vaccine is going to be available from April. They said early April. I'm checking in today. Again, they said, look, it's going to be after Easter. I don't know if maybe some of the clinics already, if some of you in the other states, we're based in Victoria, if other states have already been receiving them, but at least in Victoria, it's looking like it's going to be after Easter. Early April is what they're saying, but it might be up to mid-April, potentially late April. Hopefully, we don't have too many more delays. The private stock is already available, so a lot of clinics already have their private stock. Usually the Trivalent is what's been available. We have this year we have 2 quadrivalent influenza vaccines that are going to be available free of charge to eligible people under the National Immunization Program. So the 2 vaccines that are going to be government supplied are quadrivalent. We'll have we'll talk a little bit more about what this means later in this module. Now, the ATAGI, the Australian Technical Advisory Group on Immunisation, recommends the use of quadrivalent vaccines in preference to the trivalent vaccines. However, trivalent vaccines are an acceptable alternative, particularly if the quadrivalents are not available. So this has been the case at the moment. While we have a lot of the private stock that's available is trivalent, there's absolutely nothing wrong with administering a trivalent vaccine, but knowing that obviously if we have the choice, ideally, obviously, because we can provide a bit of additional protection with an additional strain, we would be going for the quadrivalent. Now, about the strains of the 2016 flu vaccine, we have a new composition in terms of the composition for the trivalent, which is going to be the core as well of the quadrivalent. The main 3 strains that we're going to be looking at is influenza A, H1N1, so good old swine flu, which has been a constant one for the last few years, California 2009. Then we have an A, H3N2, which is a Hong Kong 2014. We have a B, Brisbane 2008. And then for the quadrivalent, we're going to add another B, Phuket 2013. We do know that a lot of the infections that we saw in the last flu season were a lot of influenza B infections. So there is a this additional sort of importance of trying to promote the quadrivalent vaccine. Now, having said that, we know that it's actually the A strain that tends to be more or higher risk of morbidity and severe outcomes, adverse outcomes, if we have a patient who actually ends up becoming ill with influenza. So even though the B is more prevalent, the A actually tends to be more severe. Now, in terms of vaccine brands that are going to be free as part of the government supply, we've got Sanofi's Flu Quadri Junior for children under 3 years of age, and GSK's Fluorix Tetra for people aged 3 years and older. A copy of this presentation slides is going to be also available as part of the CPD module, so you'll be able to reference through all of the different areas that I'm talking through right now. Okay, so let's have a look at who are the patients who are going to be eligible for the free flu vaccine this year. We have a very similar setup to last year. Everyone over 65 years of age is going to be eligible for the free government program. All pregnant women at any time during the pregnancy, so at any stage of pregnancy, even breastfeeding, is safe to administer the vaccine. Aboriginal and Torres Strait Islander children who are 6 months to less than 5 years old. We also will be covering, or the free government program also covers Aboriginal and Torres Strait Islander people age 15 and over. That doesn't mean that people in that Aboriginal and Torres Strait Islander people are not, it's not recommended in the age group that's missing. It's just it's not part of the funded program. It's still recommended. It's recommended for everybody as long as there isn't a contraindication, but this is what's funded, okay? And also anyone aged 6 months and over with a medical condition predisposing them to severe influenza, so severe adverse outcomes as a consequence of falling ill with influenza. I've put here a list, and I'll give you the reference for the full document, where you can see, according to the immunization handbook, what are some of the conditions that qualify within that the chronic conditions, or the people who are going to be at higher risk of adverse events following an influenza infection. So in terms of these chronic conditions, we look at obviously cardiac conditions, chronic respiratory conditions, chronic neurological conditions, also patients with Down syndrome, immunocompromising conditions, so any patient who has who's immunocompromised, diabetes and other endocrine and metabolic disorders, renal disease, hematological disorders, and also long-term aspirin therapy in children that are 6 months to 10 years. This is not the only list. This is sort of the starting point. You may actually have other conditions in addition to this that would fall within the eligibility criteria, but there isn't an exhaustive list that's been published. Now, if we look at the contraindications, the only absolute contraindication to influenza vaccination is anaphylaxis following a previous dose of any influenza vaccine, or anaphylaxis following any vaccine, like following administration or anaphylaxis after having any of the vaccine components. So it's very important that we become familiar with the brands that we have in stock at our practices, so that we actually know and can have the conversation if a patient has had an anaphylactic event in the past, and we can identify that it is one of those components, knowing that the components, the strains are the same across the different brands, but the components, the stabilizing agents are different. So that's what we need to be very careful with, okay? Now, in terms of the precautions for people with known egg allergies, we now know the evidence suggests that the risk of vaccination anaphylaxis of patients with egg allergies is actually very low. Now, persons with egg allergy, including anaphylaxis, can be safely vaccinated with vaccines that have less than 1 microgram of residual egg ovalbumin per dose. Again, the majority of the brands that we stock in Australia are going to meet this criteria, but I highly recommend that you become familiar with the brands and the product information that comes with the brands that you're supplying as part of your practice. There is, however, obviously, like as always, there is still a low risk of anaphylaxis, like with any vaccine. And patients should be vaccinated in facilities with staff who are able to recognize and treat anaphylaxis. Again, this should be the case for any patient, any immunization, all right? Now, I've provided you here with a bit of a table of the vaccine brands when it comes to the quadrivalent. So in terms of the brands at the moment in Australia, and this is taken from the immunization handbook, which you can access online. The brands that we have for quadrivalent, we have Fluorix Tetra by GSK, Flu Quadri Sanofi, Flu Quadri Junior, which is the one that's going to be provided as part of the free program for children, and the Fluorix Tetra is the one that's going to be provided for adults. We have here the recommendations depending on the age bracket. We don't really, in terms of the bottom age, we've got from 6 months plus. Yeah, so we wouldn't administer to children under 6 months of age. But then here you have the check of which ones these are going to be applicable to administer, depending on 6 months to 5 years, 5 years to less than 9 years, or 9 years and older. In terms of our trivalent vaccines, we've got the list here. I won't actually go through all of them, but again, it's just a bit of a cheat sheet of which ones we can use for children under 6, between 5 to 9, and then 9 and over. Just a reminder, we've had the Fluvax from BioCSL. Remember in 2010 we had a higher number of febrile convulsions, which then led for children under 5, which then led to us recommending that this not be used for children under 5, but obviously it's more than safe to use in the adult population. Now, in terms of the recommended doses, we know that with children from 6 months to less than 3 years, the dose is 0.25 ml, and obviously all the junior compositions, or the junior brands / compositions, already come with their pre-filled syringes, and this is the amount that comes in them. With the dosing, for 6 months to less than 9 years, the first year of vaccination, we would provide 2 doses, and these 2 doses are 4 weeks, at least 4 weeks apart. And then in subsequent years, only 1 dose is going to be necessary. For children and adults above 9 years of age, we only really need 1 dose, and it's a 0.5 ml dose. Now, what are some of the common reactions? In terms of the side effects, we know that the majority of side effects that we're going to be seeing are local reactions at the injection site, including pain and redness. We might see some mild fever, mild muscle aches, some tiredness, and in younger patients we can see a bit of irritability and drowsiness. Now, remembering, talking about anaphylaxis, we know anaphylaxis is very rare but very serious if it actually does occur. So that's why it's important that adrenaline is always available and that we actually have a suitably trained provider on site whenever we're providing or administering immunizations, not just influenza, any type of immunization. Also remembering that we need to get the patients to wait at least 15 minutes after they've had their vaccine. Now, some other considerations. We know that full protection after an influenza vaccination is usually achieved within 10 to 14 days. So it's about 2 weeks where the patient is still not really fully protected while the body is responding to the antigens. Now, we know that we need to repeat the vaccination every year. Just because you've had the flu shot last year doesn't mean that you're going to be good to go now for the next few years. It only really covers you for 1 year. We also know that the influenza vaccine does not give you the flu, and this is a myth. Some people may, as I said, some people may have already been infected with the flu or a common cold that they're calling the flu by the time they are immunized, and that would have been, that might have been in an incubation period, so there wasn't really anything that the vaccine was going to be able to help for that particular infection. But also remembering that there's that 10 to 14 day period before a patient is fully protected. So during that time, the patient is still vulnerable. So that's why the recommendation is obviously as soon as we have the stock, try and immunize early as soon as possible. Okay? Now, the other reminder is the content of the syringe must be shaken thoroughly before use, and always examine them for any debris or any substance that shouldn't really, any visible debris that shouldn't be there. In my career, I've been lucky enough that I haven't ever had that issue, but you do hear of it happening sometimes. If there are any adverse events, make sure that you report them to the TGA. giving you the link there, but there's also the hotline for patients to report any adverse medicine events. So that's not just immunization, that could be any medication. Okay. Now, when we start looking at flu clinics and the different types of flu clinics, we have different setups or modalities that we can run so-called flu clinics. The more common, obviously, is at the practice. So when we're looking at running a flu clinic at the practice, we need to make sure that we're allocating protected days or times for those vaccination sessions. As we know, we're going to have an increase in volume of patients coming through. Not only are we going to have an increase in volume, we need to be able to clearly set up the expectations that if they're coming in for a flu clinic, this is going to be a fairly efficient operation where, you know, maybe five minutes is all that's going to be allocated for that appointment. So if they've got any other issues that they want to discuss with the GP, that they actually should be booking a separate standard consultation, not just trying to fit everything in as part of this one flu shot session. Okay. We know that when we do have those flu clinics, when we sort of put that time aside and either allocate, you know, a couple of nurses to handle those shifts or allocate GPs to handle those shifts, we do know that it is much more efficient and effective for patient flow. It also means that if you do it on a regular basis, patients get sort of well trained and they know year after year that what the routine is going to be, that they're going to book in, they come in, they have their shot, they wait their 50 minutes, and then they can leave. Now, there's no reason why a practice nurse couldn't be actually the lead coordinator of these vaccination clinics. As we know, we have plenty of practice nurses who are credentialed nurse immunizers. So as a credentialed nurse immunizer, you can not only obviously administer the vaccine, but you can actually initiate it without the need for the patient to see the GP beforehand. Obviously, the challenge with this is if you're a nurse immunizer and you're initiating the vaccines and the patient has not really seen the GP at any point, then there isn't really anything that we can claim usually, because in order to claim on item 3 or 23, those are really GP items, which means that GP has to have a face-to-face component with the patient. All right, so what I'll talk about a bit later is some clinics where they have this flu clinic setup. They either have a system where it's a team approach, where it's the nurse and the GP. So the nurse is obviously doing a lot of the pre-checking and giving the jabs, but then the GP is also there to sort of provide assistance, assess, and yeah, essentially it obviously becomes quicker if you've got the two working together. The other thing that we see a fair bit is workplace or corporate vaccinations. So this is when we go off-site to a, you know, it could be a nearby business, or there's clinics that have a corporate health arm or department where they actually proactively go out into businesses or, you know, offices, and they provide the flu vaccination there on site. Obviously, this setup has a couple of other different considerations. In terms of the benefit, obviously, we improve the uptake, because it means that, you know, if I'm a worker, I may not make my way all the way down to the GP clinic to have my flu shot, but if it's coming to me, then that's a lot easier. It also, obviously, by providing that better coverage, we help with herd immunity, which is when we reach that immunization coverage that then provides that protection to those members of the community who wouldn't necessarily be, or who would either be at higher risk or who can't really be immunized for whatever reason, usually, or they wouldn't respond to immunization, and you know, they wouldn't actually become protected if they were immunocompromised. All right. So in terms of the challenges of having an off-site or doing a workplace vaccination, as we know, obviously you have to have the staff that's trained and capable. There's the logistics in terms of the transit, all the equipment, obviously all the anaphylaxis management equipment and training, but also the cold chain logistics. How do we make sure that we are keeping these vaccines in the right +2 to +8 degrees range the whole time, okay, up until moment of administration. Then the last modality that I wanted to talk about was pop-up or mobile services. Now, we don't really see a lot of this in Australia, but we do have certain like outreach type services where they'll do either a community intercept Again, we don't really see this a lot, but there's no reason why we couldn't do this. We're in a shopping center. You set up a flu vaccination tent, or you see it obviously with outreach services going out to the homeless community or disadvantaged communities. So that's another way of trying to get our immunization uptake and coverage improved. Now, in terms of how we prepare the practice, now when we're looking at preparing the practice for safe and efficient patient flow, we have a couple of approaches. We have the opportunistic approach, and then there's the planned approach to flu vaccines. Obviously, the opportunistic approach, like the name suggests, is when the patient is coming in for whatever reason, and then we're using it as an opportunity to go, oh, actually, while you're here, you're eligible for the flu vaccine, or it would be a good idea for you to have the flu vaccine, even if they're not eligible for the free government-supplied version. Again, we can obviously charge them privately for this. So that's the opportunistic approach. The planned approach is when we sort of take a step back and we go through this in a bit more systematic way. So this is when we would, for example, use our clinical software to pull up a list or do a search, get a list of all the patients who are eligible, and proactively invite them to have the immunization. We would be allocating, again, as I said before, nurse and GP times and sessions or days when the flu clinics will run. We'll decide if the practice is going to be bulk billing for the services for this immunization, or if we're going to be private billing the consults. Okay. We also must make sure that we inform all the staff of what the flu clinic process is, because obviously the patients are going to be ringing the clinic, booking with the receptionist. If the receptionists are not aware of how this works, they might be allocating patients to the wrong providers at the wrong time, and then the whole system sort of falls apart. So make sure that you get everybody on the same page, either as part of a staff meeting or through a memo that can be circulated to all staff. The other thing is to make sure that you have enough stock to meet the demands of your practice. If you know that you're going to get inundated with demand and you only have a limited amount of stock, it can be a good idea not to over-order stock, because if we were to have any kind of cold chain breach, then that's a big loss, financial loss, and the cost of vaccines it's considerable, including government vaccines. Just because we're not paying for it doesn't mean that they don't cost anything. All right, so make sure that we have enough stock to meet demand, but not too much that we're going to be left over with excess, far too much excess stock at the end of the immunization season. Now, we also need to make sure that we discard any stock from previous seasons. Very important, because what happens is we need to make sure, obviously, that we check expiry. If you've got a mix of last year and this year's season, it's very, very easy for a staff member to just pick up the wrong vial and actually administer strains that were protecting last year. Not to mention, obviously, the majority of the time, by the time we get the second lot of or the new lot or the new stock of vaccines, the old lot has already expired. So obviously make sure that we keep our stock up to date. Check that the vaccine fridge temperatures are recorded daily, that we haven't had any breaches, because there's no point in immunizing all these people if we've got vaccines that are not actually viable. Yeah. Ensure that there's adequate equipment and staff, again, from anaphylaxis management. Very important, every single time. Can't emphasize that enough. All right, so let's have a look at preparing the practice for safe and efficient patient flow. How do we recruit patients? Now, in terms of how do we recruit patients, some patients will recruit themselves. They'll be quite up to date. They'll know as soon as March, even sometimes February comes around, that, oh, is the flu vaccine in? Is the flu shot in? Can I come in for my flu shot? So sometimes that can work quite well, especially if we do it on a regular basis. The patients know to come by themselves. But obviously other more proactive ways of doing it is obviously having a poster in the waiting room to promote flu vaccination. There's the Department of Health hasn't really published the resources yet for this season. They should be up any moment now. It's sort of imminent. They said mid to late Feb. We're still waiting on them, but knowing that the actual stock is going to be arriving in a couple of weeks, we know that the resources should be coming up soon. Now, we've got, so posters in the waiting room. At HOTA, we're actually designing a poster as well, which will be ready next week. So you'll have that as well, and we can actually send it out to practices that are hot dog clinics. And if you're not a hot dog clinic, you'll be able to download it as part of the CPD module. Now, in terms of proactively inviting patients, as I said, when we identify the patients who could be invited, we could either send them letters. Letters are becoming really expensive, so some clinics, might phone. Again, that would probably take a fair bit of time. Or what's becoming more and more common is sending mobile notifications to let patients know that we've got the flu shots available and to come in and book an appointment. Okay. In terms of if you're a hot dog clinic, you just need to get in contact with us because we can support you with this whole process. Okay. In terms of promoting flu vaccination, we need to promote this to all patients, not just to the patients who are eligible for the free government-funded program. It's important to make sure that we get as great a coverage, immunization coverage, as we possibly can. And this includes immunizing practice staff. We're notoriously bad at having a good coverage within our own practices. Health professionals, as a general rule, tend to be fairly tricky to pin down to get their immunizations up to date. So make sure that you offer it to all your staff, reception staff, clinical staff, and even if you've got any external providers that come in, any cleaners, or if you've got accountants, bookkeepers, offer it to absolutely everybody. In terms of some of the essential resources for safe and efficient patient flow, as we've talked about, waiting room posters to help promote vaccination, keep that awareness going, invitation templates. So with hot dog, we actually have a set wording that we use, that we know and we've actually tested it, and we know that it actually helps convert patients or highlight the importance of why you want to have this vaccination done. It's not just a, hey, come in, it's free, or it isn't free, but it's cheap and it'll help you prevent the flu. It's like, well, no, actually there's more to it than that. It's important to have it every year, but also it's about protecting those who are most vulnerable in the community, so the elderly and the very young. Okay. In terms of, the other thing is patient fact sheets. So being able to have pre-written fact sheets or consent forms that you can hand out to patients, or even just have them in the waiting room so they can have a read of them. You don't have to get patients to sign a consent form before they have their immunization. Verbal consent is enough, but having that written information is a great way to support, obviously, that education component, but also it might reassure some of the messages or support some of those messages if they take it with them away, and they've got, just knowing that they might have some side effects. They're not going to get the flu from the flu shot, but they can get some slight flu-like symptoms, and that's fairly normal, and it's part of the process of the body learning how we would fight these antigens. Yeah. In terms of clinical reference, we should all have a copy of the Australian Immunisation Handbook. Ideally, have it available in electronic format. So have it available, have a link to it from your desktop. The reason for this is, as soon as any material is published, it becomes essentially out of date immediately, because obviously by the time it's published there might have been changes and shifts. The online version is always going to be the most up-to-date version of any publication. So have a link, have it put it in your browser as part of your favorites to the handbook 10th edition. Okay? Make sure that you also have the reference sheets for age brackets, brands, and dosage information for the specific brands that you're going to be carrying. So if your clinic is going to have, set brands, obviously, for either for in-house or for workplace type vaccinations, make sure that you actually have access to those product information sheets so that you know all the details in terms of, who do we give to what patients and how much, just to make sure. The majority of the vials come in with the right dosage if it's an adult version or if it's a junior version. And make sure that you also have access to anaphylaxis management tables, so the dosing tables. They're also available as part of your immunization handbook. So they actually have the table and the chart. Good idea to print that out and usually have it available in every single room in your clinic. Have it next to your adrenaline kit, because again, if you're reaching out for that adrenaline kit, you want to ideally have everything in the one place at the one time. Make sure that also the adrenaline is within expiry dates, that you haven't forgotten about it and now you actually have expired adrenaline. And when we look at the nurse's scope of practice, because again, obviously this is a grey area for nurses to be involved, we have RNs, Div 1s, and medication endorsed ENs or Div 2s, who can obviously participate as part of the flu vaccination efforts. Now, when we look at these two nurses, the influenza vaccine, just like any immunization, is actually a Schedule 4 drug. Yeah, so it's a prescription drug. What this means is the vaccine must actually be initiated and authorized by a GP prior to administration. So this means that there has to be a GP must be readily available as well in the premises. They don't have to be present in the room when you give the shot if you're one of these nurses, but they do need to be in the building in case of anaphylaxis. This being in the building also means being in the building for the 15 minutes that the patient is going to be waiting. So it's not just a matter of, yep, so the nurse is giving the injection, I'm going to head out now. No, you have to be there while the patient is there waiting as well, because obviously if we have an event, we need someone who's going to be able to manage it. And also make sure that whoever the GP is that's authorizing or ordering that immunization has made an entry in the patient file reflecting that they're to have that flu shot. Okay, so that's the key thing to keep in mind. In this scenario, obviously, if the GP is seeing the patient, then they'd be well within their right to claim on item 3 or 23 as applicable. Now, if we have a credentialed nurse immuniser, so these are the nurse immunisers that have done the course to be credentialed nurse immunisers, meaning that you can initiate vaccines without the need of the GP approving or authorizing or initiating anything. So you can initiate these vaccines as part of the National Immunization Schedule. You don't need to have the GP involved at any point, but also make sure that if you're one of these credentialed nurses, that you have your CPR and your anaphylaxis management skills up to date, because you're it if it comes to an event, if a patient has obviously an anaphylactic event, right? So in terms of billing considerations, we have bulk billing versus private billing. Obviously, in terms of the item numbers that are most commonly used, we have item 3, which is brief consult, must include a GP component and an entry in the patient file. Then item 23, which is a standard consult up to 20 minutes, must include again GP consult and a file entry. And then we have item 10997. So this is your nurse monitoring and support item that doesn't really need the GP. We can only really claim this if the patient has at least a GP management plan or GPMP in place, and we can only really use this item if the consult is or if the service that we're providing is in line with the contents of that plan. So if within that GP management plan, it identifies some things that relate to the consult that we're going to be providing. So for example, you might have a diabetic patient, and for a diabetic patient or anyone with a chronic condition, it's a good idea obviously to recommend that one of the yearly interventions is to have their flu vaccine. Now, when we're looking at using this item, it can't just be about giving the jab. Just giving the immunization is not really enough of an intervention. I would say as part of that, obviously, you use it as an opportunity to educate or monitor how things are going in general. Yeah, so it could be about, have a conversation about how they're going with their medications, any side effects, any of the interventions that you've got going. If you've been referring them to providers, have a quick chat. Again, it doesn't have to be long or complicated. It can be just patient education or just staying on top of things that have been planned or goals that are in the plan. It doesn't have to be long, but it does have to be documented in the patient file if we're going to claim this item. Okay, again, this item, the 10997, doesn't need the GP to be involved, but it does have to be in line with what's in the patient's management plan. Now, we also have a scenario where we can do private billing without a Medicare rebate. What does this mean? You can actually there's clinics that have a private fee to see the nurse, and it's a non-Medicare rebatable fee of, it can vary from $5 to $15 to up to $20. Obviously, if you're going to be charging this, and again, there's clinics where patients don't mind having this cost, you have to let them know beforehand. So make sure that you have either signs in the waiting room or when they book for the appointment, say, yes, they'll actually incur all our consultations with our nurses incur a $5 non-Medicare rebatable fee or a $10 fee that's not Medicare rebatable as part of the service. Obviously, as long as they're forewarned and they have enough notice and they're agreeing to it, it's usually not an issue. All right. If the patient is not eligible for the free government supply of influenza vaccine, then obviously you must use your private stock, not use the free government supply and charge them privately for it. That's fraud. So you must use private stock that you've bought in. And obviously the price will range from, I've seen it as low as $8 up to $25, $30, standard being around the sort of $10, $15 mark. We know that obviously there's also pharmacies that are now providing immunizations on site, so there can be a bit of competition with those the private stock. So there's a question here. We're now seeing pharmacies offering influenza vaccine. Are you aware of how they operate and what quality control is used to ensure they meet current guidelines? So I haven't actually worked myself with pharmacies. I do know of there's pharmacies that obviously either contract doctors to work out of their site, or they might bring in nurse immunizers, credentialed nurse immunizers, who are actually the ones handling the vaccinations. I actually haven't had any personal experience with with pharmacies where the pharmacist themselves is the one administering. Usually we see that it's either going to be a GP that's contracted to do those flu shot sessions, or a credentialed nurse immunizer. So obviously by having those two types of providers, it'd be the same level of standard, because those providers would be required to manage anaphylaxis and be able to obviously take care of anaphylaxis should it occur. And another question is, can you charge a Medicare rebate with a private billing for the flu shot? Definitely, yeah. So you can actually have a patient coming in for a private flu vaccine. So you can charge them for both. So you can charge a private billing item for the consultation. So, a clinic might charge $60, $70, $80 for a standard consultation. Obviously, then the patient would get back their Medicare rebate out of that. And then on top of that, you could charge them privately for their vaccine. So that could be, again, between $8 to $10, $15, $25, or however much you decide to charge for the vaccine. You can also do a bulk billed session and then charge privately for the vaccine if the patient is not eligible for the government supply. So again, that would be privately paying for the vaccine if they're not eligible, but the consultation where we assess if the patient is actually suitable to have the vaccine, and we assess obviously any contraindications or anything, that consultation could be bulk billed. Let's have a look at any other questions. Will there be a recording of this session? Yes, we'll definitely have a recording of this session. So the question was, is a credentialed nurse immunizer one who holds a vaccine certificate? So to become a credentialed nurse immunizer, there's actually set courses that you need to do. It's not just a matter of doing a quick refresher course or a quick CPD workshop. The courses that lead to credentialing tend to be, there's one online that is done by the College of Nursing, and again I think it's about $2,000 or so. Like all of the courses that lead to credentialing are around that price point. There's also a couple of universities that run them. So I know La Trobe University runs them. Some of the health departments run them. So if you're a nurse and you're not quite sure if you are or you're not, then I would highly recommend that you visit your state's Department of Health and look for nurse immunizer requirements. If you've done a course that leads to credentialing, you would know, because they're actually quite comprehensive courses and the assessment tends to be fairly strict as well. Do you get a certificate for this training? Yes, so as part of the when we publish the course, which will be again next week, we always provide a certificate. So it's a PDF certificate that you can actually update with your details, and you can print and download or keep a copy of it, and that will be for 1 hour of CPD. And what else? So there's a question of how HotDoc can support the clinic. So in terms of supporting the clinic, there's a couple of ways. So if you're a HotDoc clinic, you actually have access to myself as a clinical director. So I can look at, if you're looking at obviously immunizations or care planning or whatever it is, we can look at how either we can do strategy sessions to discuss how your clinic where there could be efficiencies gained, or where there could be, there might be training gaps that your practice staff may need some upskilling on. But the other thing that we can do is, for example, with flu vaccination, we can support you with what's going to be the best way to reach your patients to promote either the government funded program or the private program through, obviously we've got, there's online appointment services, but there's also the mobile notifications or the recall service. So yeah, so it's just a matter of setting up, letting us know that you're interested, and that would be a phone conversation with myself. Okay. Another question. Can nurse practitioners initiate flu vaccines? Very good question. Usually if you're a nurse practitioner, you would, again, if you're a nurse practitioner, as a nurse practitioner, you would have, in your scope of practice, you would have the medications that you're able to initiate. Yeah, so you actually were able to prescribe and initiate a fairly set list of Schedule 4s. So you would know as part of that list if it's included or not. Again, you might have several nurse practitioners. Usually the ones that are in general practice have already done a credentialing course for immunization, so it's usually not an issue. Yeah, you don't need to be a nurse practitioner to be able to initiate. You just need to have that credentialing course, which you can do before becoming a nurse practitioner. Who qualifies for free flu vax but private consult? Essentially anyone. So the question is, when would you have the scenario where you would charge a patient privately for the consultation, but the actual vaccine itself is free because they're part of the government-funded program? So potentially anyone. If you're in a private billing clinic where patients over 65, for example, would come in and see you, and if they see the GP for a standard consult, they'll pay $70 or $80 or whatever it is. Then you could do exactly the same. So they pay for the consultation, and then the vaccine itself, because they're over 65, it's part of the funded program, so they can get that component for free. So that's an example of that. Here's a very good question. How does the government monitor practices who advertise free flu shot and give the government vaccine for fee to non-eligible patients? It's a great question, and unfortunately, I'm actually not aware of a way that they sort of monitor practices for this. It very much relies on a trust system. Obviously, they could potentially, and again, I have not had any experience with anyone being pulled up as part of a vaccine audit, but it could happen where they might ask you to substantiate the encounters that you've provided for the amount of vaccine that they've provided you with. So for example, if they've provided you with, say, 100 flu vaccines, and they come in and do an audit, or you then ask, we need another 100 more, they might go, well, obviously this is a nominal example. I'm not saying that 100 is going to trigger an audit, because obviously the majority of clinics are going to be well above that number. They might, it's hypothetical, they might go, well, we need to see substantiated evidence that where did the first 100 go, or a list of patients. Again, this has never happened to my knowledge, but it's not to say that it couldn't happen, and it's certainly well within probably their right as the providers or of the government program to potentially audit a clinic. Again, I haven't seen it myself, but that's how it would probably happen. It would be asking you to substantiate list of patients that are meeting that eligibility criteria. So another question is, as a nurse, do we need to have a standing order in place in order to give the flu vaccine? So in this example, it's if the patient has seen the GP is happy for the patient to have the flu vaccine, the patient comes in at another time to have their flu vaccine, and their GP is not there. Can that nurse, if there's a standing order, or if that GP has written that this patient should have the influenza vaccine, can they go ahead? Technically, yes. So you would be using that written order in that patient file saying that this patient is to have this vaccine. You could use that as the authority to provide, because you're not the one making the decision to initiate the vaccination, okay? Having said that, just remember that if you're not a credentialed nurse immunizer, you need to make sure that there is a provider in the building who can manage anaphylaxis. So there should be another GP in the building while you're administering the vaccination, not necessarily in the room with you, but in the building, but also for the 15 minutes following that vaccination when we're getting the patient to wait in the waiting room, okay? So those are the main things to remember. So it's a good example. We've had issues with trying to bulk bill the consult, but then charging for the vaccine as Medicare knocks it back if it's on the same receipt. The reason for this is because what we're not really allowed to do is we're not really allowed to claim equipment, use of equipment type items in addition, or charge for additional equipment use or disposables as part of a bulk billed consultation, because it's seen like, well, as part of the consultation it would include all the equipment and things that you're going to be using. Having said that, though, it's separate when we're looking at if we're looking at vaccines. So that's a specific product that is not really part of the standard. It's not gauze, it's not cotton, it's not a tongue depressor. It's actually a specific separate product. So just make sure, it's a good point, just make sure that you don't put it through in the same claim, so that you're very clear with the patient that there's a private cost to the vaccine. We will be bulk billing your consultation, so that the consultation is bulk billed separately, and then you create a separate invoice that is just for that amount of the for the amount that you're going to be charging for that private vaccine. What item would you bill? Again, it depends. You can bill if you're involving the GP, items 3, 23. If you're just the nurse by yourself, you could do 10997 if you have a patient with a chronic condition who has a GP management plan in place, and that 10997 is up to 5 of those in a calendar year, so from the 1st of January to the 31st of December. But you can also charge privately, completely separate from Medicare. And obviously, as long as you let the patient know, this is a non-Medicare rebatable fee. You will not get any money back from Medicare, and it is, it's a $5 fee, $10 fee, or however many dollar fee to have your flu shot done. Do you suggest we keep some private flu vaccines on hand to give, or get the GP to write a script for the patient to fill? Great question. Ideally, you would have, if you know that you're going to have patients coming through needing private stock, you would order in advance some private stock to have as part of your, to keep in your fridge. That, for a couple of reasons. One, it saves the patient the time to, go to the pharmacy, get that filled, then come back, then try and again arrange for the time to be seen and get the jab. But also then you're reducing the likelihood that if they're going off and getting it somewhere else, the chances of there being a cold chain breach and them leaving it in the car for too long and it going completely out of temperature range, it starts getting higher and higher. So if you can have a small, even if it's a small amount, while you're sort of testing and checking what the demand is going to be, a small amount of the private stock in your fridge, that would be ideal. And just make sure that obviously you keep it separate from your government stock, so that you can obviously allocate the right vaccine for the right patient. Any other considerations for offsite clinics? For example, legal considerations. Obviously, the main thing with offsite clinics is to make sure that you're sending out people who are well trained, that you have good cold chain procedures in place, but also that your insurance, both for the provider who's going out, but also for the company that's going out. So if you're going on behalf of your clinic, make sure that your insurance covers you for external services or providing services on site. Because again, from a public liability point of view, if you're there and you don't dispose of a needle or a sharp correctly, and someone gets jabbed with it, or you have a needle stick injury issue, or someone trips over your esky or whatever it is, you would possibly be liable, and you could definitely be sued. So it's good to make sure that whatever insurance you have in place covers your providers or your clinicians who are going out on site, but also it covers the clinic or the company or organization that's going out to provide that service. Okay. Now we've actually now reached our conclusion, because we wanted to finish at 1:15. So I will continue with these questions. Obviously, if you've got the time, feel free to stay on the line as I answer these questions. Otherwise, thank you so much for your time. We will record the rest of these questions, and they will be up and available for you next week when we publish this session. All right, I'll just answer a couple of other questions. Can you confirm if a credentialed nurse immunizer can go out to a business and give a flu jab without a doctor present if a doctor orders is given in Western Australia? So specifically, so this is the thing, that the nurse immunizer power or capabilities vary between, or I would say authority, varies from state to state. So off the top of my head, I can't guarantee what the scenario is in Western Australia, but if in Western Australia you do have a scenario where credentialed nurse immunizers are seen as authorized to initiate services in the practice, then usually that should be fine as well to go out on your own. Obviously, as long as you've got the support of your head company back in head office, and that you're fully trained and you're fully equipped to manage any anaphylaxis that may occur. So usually, if you're a credentialed nurse immunizer, that's fine. If you're not, if you're a registered nurse Division 1 or an enrolled nurse, a medication endorsed enrolled nurse, then you have to go out with a GP who you'd be essentially assisting, or who you'd be working in partnership with. But yeah, the specific WA question, I would actually refer back to have a check with your local health department, just for the regulations around credentialed nurse immunizers, if they are recognized or not. And if you are recognized, then that should be fine to extend to workplaces. How do you get the private stock? So to get private stock of flu vaccinations, obviously through your medical suppliers. So you've got, there's plenty of companies. There's RG Medical Supplies, Warner Webster, eVols Group. There's plenty, any of the suppliers. Sometimes, but this is rare, you might be able to negotiate it directly with the companies, so with the actual pharmaceutical company, but that is extremely rare and usually only happens if you have really, really high numbers of stock ordering. Aside from that, usually you would be having to order it through a supplier. And a lot of times, obviously, unless the stock is not available, the delivery can be, once the stock is available, it can take only a couple of days. So you can order it today and have it in your clinic in the next day or so. How does a clinic become a hot dog clinic? That's a good question. So in order to become a hot dog clinic, essentially, so if you're using any of the hot dog services, so the hot dog services are obviously the online appointments or smart recalls, or now we're going to have hot dog reminders. So that's it's another one of the mobile sort of services to help connect the practices with the patients. So yeah, if your clinic is using any of those products, then you're a hot dog clinic, and then you obviously have access to that additional level of support and strategy discussions. Is there any cost for hot dog immunization clinic? I'm not quite sure what that means. If it means, because one of the things that we can do at Hot Dog is you can actually, with your online appointment service, you usually would set up obviously all your individual providers, and we have the ability to decide, or allow you to decide, what providers provide what services. So because of that, what it means is you can create a provider in your appointment scheduler, so in your appointment book, a provider that's a flu clinic provider. So that's essentially where you'd have, where you'd book all your patients who are coming in for their flu shots. And then what we can do is that if a patient is looking for an appointment and they say that the reason for the appointment is a flu vaccine, then automatically it gets allocated to that flu clinic provider. So that way we make sure that we're only booking them for the amount of time that you want to make those appointments, but also that they're not then essentially wasting standard consults with other providers, that we're trying to, kind of funnel all these flu shot people into this one flu clinic provider. Now, with that flu clinic, there isn't an additional cost for that. Obviously, if you're already using online appointments and you've got your other, GPs set up, you could just contact our support team and we could help you with the particulars of setting that up. But there isn't an additional cost for that, just like there isn't an additional cost for our with the flu recall templates that we use as part of the Hot Dog Smart recalls. That comes for free as part of the service. How can I note that a few staff members have attended this webinar? So as I mentioned before, what's going to happen is we will send out the link to the CPD module. From that CPD module, you'll be able to download the CPD certificate. So that CPD certificate, you'll be able to modify and add the names of whatever staff member you want, or even just send it directly to the staff members and they can put in their details. Print a copy and then you can keep it for your records so that you can show it at accreditation time, or just obviously so that the staff can have it for future reference. Can you use vaccines alternatively? If you run out of government-funded vaccines and you use private vaccines until you get the government-funded vaccines. So this is a practice that can happen. So this is, we've got the government stock, we ordered some private stock, we ran out of the private stock, we needed to give some more private jabs, but the only ones that we have left are the government vaccine. Technically, we should only obviously keep those government vaccines for the government supply, but you do hear of clinics that then will use some of those, but you have to obviously keep very, very close track of this, and it's not a recommended process. Ideally, the recommended process is to order enough, and if you're running out, then for those few while you've run out, get them to fill the script. But you can, or clinics do, use some of the government vaccines, keep track of those, and then replace them with private stock once the private stock arrives. What we do not want to see happen is you using all of the government vaccine for your private patients and then being left, and then actually having patients who are eligible for the free government supply, who are higher risk, which is why they're eligible for that supply, and you go, oh, I've actually run out now because I've used all of it for my private law. That's the one issue that we want to avoid. But obviously, as long as you're keeping very, very close track of anything that's administered and you're replacing it, then you could sort of say that that's possibly okay. Yeah. Should accredited nurse immunizers have their own insurance, or are we covered by the company that sends us out? So if you're going offsite, or even if you're in the practice, the recommendation is for all nurses to have their own insurance, regardless of whether you're a contractor or an employee. It's a good idea. It's not that expensive if you do it through either APNA, or if you've got the ANF membership also includes insurance. Just be mindful that the ANF insurance only really covers you as an employee, doesn't really cover you if you're doing contract work, which is often the setup when you do off-site. So if you're doing any off-site work and you're not doing it as an employee of whatever provider, you're doing it as you're contracting your services, then highly, highly recommended that you get your own professional indemnity insurance as a contractor. APNA has a deal with an insurance provider that gets you a good deal, and it does cover you then as a contractor. Okay. Do you meet to explain the services? I imagine this is the hot dog services. So there's obviously we have the sales team that is able to obviously answer any questions, provide demos for any of the services. So that's just filling out the request a demo form. We, in terms of meeting face to face, we do go to events. So we recently were often at the conferences. So if we're at the RACGP conference, the AAPM conference, APNA conference, so that's another way of sort of meeting us face to face. Or we often can also we sponsor events at PHNs, primary health networks. So that's another way that we often see practices face to face. But our sales team is always available, so you can reach out to them, send out a request a demo form, and they can actually show you, they can send you a smart recall to your phone, so you get to have the patient experience. They can, you know, allow you to have a play and see what the dashboard looks like and see how everything behind the scenes looks like. So you actually get quite a comprehensive experience. Is HotDoc compatible with Practice? At the moment, we're compatible with Medical Director Praxsoft, Best Practice ZMed, and Monet. So those are the softwares that we integrate with at the moment. So Practice, unfortunately, not at the moment, but it's obviously always good to know which softwares people are using. So, because then obviously that adds to the list of, you know, which one we'll integrate with next. So now the last thing that I'll do is I'll see if I've got anyone here. No, I don't have any other questions, so that is everything for now. Thank you so much for your time. If you've got any questions, you've got my email address there. Feel free to send it through, and thank you again for participating.